Good evening, everyone. It is so great to be back with you again. We are starting the third season of my YouTube videos and relaunching again the Mastering Pregnancy and Birth Coaching Program. So I would love to just see who might be joining us tonight and hoping that you will find this session to be informational to you as I introduce the Mastering Pregnancy and Birth Coaching Program, and to also answer any questions that you might have. I'm going to get started as I know that your time is valuable. And I want to just give you some idea as to what we are going to be covering in the Mastering Pregnancy and Birth Coaching Program. So let's get started. I'm going to get my presentation up. I'm going to hide myself a bit as we look at this so that you're able to get the full view of the presentation. So this is Mastering Pregnancy and Birth. And let me just say welcome to all those who have joined, and to move on with a hearty welcome and to introduce myself. Who am I and why am I doing this coaching program? Let me give you a little bit of my background so that you can see that I do bring expertise to this. I am a nurse midwife. I have been in clinical practice since 1979. I practiced for 24 years as a nurse midwife in both public and private settings, providing prenatal care, labor and birth, postpartum care, family planning, well women health care, gynecology as well. I have also managed maternal child health, family planning, and reproductive health international programs for 20 years. I've been on faculty at numerous schools of nursing. I've been really graciously recognized by the American Academy of Nursing. I'm one of those members who are fellows in the American Academy of Nursing, which represents the top 1% of nurses around the world. And I've received the top award from my professional organization, the American College of Nurse Midwives, for a Lifetime Visionary Award. Also, in 2024, I was listed in Who's Who in America. So that's who I am. I hope that gives you some background on me. What I'd like to do is to provide an outline of what we're going to be covering tonight so that you can see what is in the course. And hopefully you'll see that this course is something that you could use, either if you are thinking about becoming pregnant, whether that be in the next 1 to 2 years, if you are currently pregnant now. And also this course is for those who are birth workers, for those who are doulas, for those who are assisting families in any way. This course is also for you. For those who are overseeing those programs throughout our country, this program is also for you. My question that I ask is a key question. What do you want your pregnancy and birth experience to be like? This was a question that was asked by the first medical director that I worked under in the 1980s, when I worked at a very interesting place in Philadelphia. And this was the question posed to every family. What do you want your pregnancy and birth experience to be like? So I'd ask you to let's take about 30 seconds to just jot down whatever comes to our minds, whatever we think of. So I'm going to do 30 seconds with that. How you doing? Okay, let's move on and see. Let's take a look, first of all, at what's going on with maternal death rate in our country. As you see on the banner that's streaming below, we're the worst country. Of all developed countries in the world, the United States is the worst when it comes to women dying when they have their babies. And when we talk about the term maternal mortality or maternal death, we're looking at those that have died. That term is up to the first 6 weeks after you've had your baby. However, when we look at the death rate for women of color in the United States, what we're going to find is that Black women are dying at 2 and 3 times the rate of white women. If you look at this graph, you will see the lighter orange lines are from 2018. This is going from 2018 to 2019, 2020, 2021. And as you can see, for everybody, the rates are going up until we get to the Hispanic population, even their rates are going up. But when you compare Black women to white women, you're looking here, we have 32.9% up to 69.9. These are the rates in 2021. It's almost 3 times the rate of white women. And as you can see, this is looking at your other populations. When we look at what's going on by the age, what we're seeing is that you're much healthier. We're much healthier when we're younger. Up the age of 25, the rates are not so bad. But when we start going from the age range of 25 to 39 and then 40 and over, a major, major jump in the rates of women who are dying when they have their babies. And so your race and your age makes a big difference. When are these moms dying? And what we're going to see, let me just back up on that question. When are mothers dying? Approximately 47% of moms are going to die within that first week after they've had their baby, the first 7 days, which is so, so critical. And then when we talk about pregnancy-related deaths, we're looking at the number of women who are dying up to the first year after they've had their baby, or it's what we would say the baby's first birthday. That's when 50%, 53% of women are dying. So that first year after you've had your baby is so, so critical, so critical. We're going to look at the reasons in terms of why women are dying and can this be prevented? The reasons that women are dying, there are 5 main reasons. One is mental health. Most women are dying from mental health. That is the main reason. The second reason is due to cardiac problems, and the cardiac problems extend into what we call preeclampsia and eclampsia. I'm going to give you some examples to bring this home a little bit more as to who has died from what. We have a number of Black women who have died during pregnancy. Tori Bowie is one. She was an Olympic athlete, the picture of health. You would not expect someone of her, what shall I say, her, physical level to pass away. She died from what we think to be complications related to eclampsia and cardiac, which we would know also a term known as toxemia. If you were to ask your grandmothers and older aunties about that, they would tell you that that term is toxemia. That is what caused her to pass away. As I read information around her death, I also think that she had some mistrust of the healthcare system, and she was found at home when she passed away. Serena Williams. We all know Serena. Serena was 35 when she had her first birth. And she, of course, would know herself well. We all know our bodies well. We know how we feel, we know how our bodies function. And after she had her baby, she knew that there was something that was not right. She was having difficulty with breathing, and she had to plead for attention. They were dismissing her, and she's like, I know what's going on with me. She had problems with what is known as a blood clot to the lung. That medical term is known as pulmonary embolism, and she was treated for that. But had she not advocated for herself, she could have had more serious outcome than what she had. What about Beyonce, y'all? Beyonce was 36 when she had her twins, and she, like Tori Bowie, experienced preeclampsia. Beyonce had to be on bed rest for a number of weeks due to the preeclampsia that she had, and also likely because she was carrying twins, also the need to rest more to let those babies grow well. But Beyonce experienced preeclampsia. Again, that term, the old time term known as toxemia. And then there's Kira Johnson. Kira Johnson was 39, also a picture of health, very athletically engaged. She was actually an airline pilot. She had her pilot's license. Uh, very, very healthy. And she was going in for her second planned cesarean section. And what occurred with her, the cesarean section went fine. She arrived, went through the surgery, and it was in the recovery room that her husband discovered blood in the Foley catheter tubing. He was the one who saw that, and he asked for attention to be paid to this. With Kira, they were to order a CAT scan to further testing to see what was done. But what happened was time went by. Her husband continued to ask about this. Time went by. What was supposed to be a STAT, meaning immediate, urgent testing, got delayed. And so when they took Kira back, they took her back to open up the cesarean section site. And what they found is that she had bled into her stomach from her cardiac system, her blood vessels. She died on the table. And so these are the complications due to cesarean section. Now, I would love to ask you all, how's it been for you to get appointments in the healthcare system? We know that there are problems in the healthcare system, particularly for women of color. We know that women of color feel that they are not listened to. They feel that they are mistreated in the healthcare system. And so we want to be aware of what some of those problems can be. And so this course is going to address some of the problems that we can see in the healthcare system. Some of those problems being the high cesarean section rates at some hospitals, also looking at infection rates at some of these hospitals. So these are some things to consider. The things would be, as I mentioned, do you know what the cesarean section rate is for your hospital? You will find that out in this course. Is your hospital baby friendly? You will be able to know how to research that in this course. The question that I ask is, how far are you willing to travel? Where my family lives in Southern Maryland, we know that we need to travel to get the type of care that we want. And that travel can sometimes be an hour or more. And the question that I would ask is, how far are you willing to travel based on where you live to get the health care and the type of birth experience that you're willing to have? That's a question to ask yourself. Every time we go to see a medical provider, we're asked to sign consent forms if there is the start of the time that you're new to a practice, a health provider's practice, or if there's any kind of procedure that's going to be done. You're asked to sign a consent form. And the question is, do you understand what you are signing in that consent form? This course is going to help you to look at what are the elements that ought to be a part of a consent form. Things such as, what is the reason for the need for the procedure? What are the pros and the cons for the procedure? Has that been explained to you? What are the percentages of outcomes related to the procedure? All of these things are options within the consent form. Has all of this been discussed with you? Have you had the opportunity to ask questions before you sign the consent form? And so, therefore, it's really important to know what are all of these things that you should be thinking about when you're looking at consent forms. And know that you understand when you put your name on that dotted line or straight line that you know exactly what you are signing for. This course will review all of that information with you. What about insurance and parental leave? We all have different types of insurance policies. There are some who may not have insurance at all. And it's important to be able to understand the costs related to childbirth, what would be the percentage of that cost that you will have to pay out of pocket for under your insurance, like what percentage is a copay that you would need to pay. And to know that there are ways to be able to improve your insurance coverage for what you want to have. What about parental leave, meaning maternity and paternity leave? Do you know how much leave you have? Is your leave paid leave, meaning that your provider, I mean, not your provider, but your employer will pay for your leave while you're off work? Or is that something that also has to be paid out of pocket, that there's no payment? It's leave without pay when you go on maternity or paternity leave. All of that is very, very important to know. This course is going to have you review your insurance policy to know what type of policy you have, to know what are your deductibles for your insurance, to know what exactly you would need to pay out of pocket, to know how to get information on the actual costs for uh, not only your labor and birth, but for prenatal care, for newborn care. You will be able to know how to get that information so you know exactly what you're looking at when you're talking about costs related to having a baby. And then also to know exactly how much leave do you have. There will be a sheet for you to monitor your leave so that you're not caught off guard when it comes time for wanting to take maternity and paternity leave, that you know exactly what you have, and that there's ways that you can supplement that leave or that by purchasing things such as short-term disability. All of this is covered in this class. We know that the lack of insurance and the lack of leave can be very much an issue and a problem when it comes to finances. If you have to then pay for these things, it can really put your family in a bit of a financial bind. So, this course will help you to be on top of all of that so that you know exactly what's what. So, as we look at all of these things, all these questions get thrown at us. Things such as, oh my gosh, what's the cesarean section rate at where I'm going? You know, are they baby friendly? Who are these providers anyway? Like, do I really know who's taking care of me? Do I know what their background is like? What about my insurance? Wow. What is covered or not covered by my insurance? How much leave do I actually have? And instead of you moving to the baby's birthday or the due date with all these questions on your mind, and then that brings a level of anxiety and worry, I want to relieve you of that and tell you that it doesn't have to be this way. that you can do something about that. I'm going to come again to the question and have you look at what did you write down when you thought about what do I want my pregnancy and birth experience to be like? And what I want to suggest to you is this. It can be yours. It can be yours. You can have, no matter what happens during your pregnancy, during your labor process, during the birth process, you can still have an experience that's personalized to you, that gives you that really important memories around this whole birth experience. All of these things can be yours. At the end of this, my goal is for those who participate in this program is to know that you can take control of your health. You can take control of your health by learning more about yourself. You can improve your health risk going into pregnancy and even during pregnancy, that you can improve any health risk that you might have that could trigger problems during your pregnancy. That you can choose your health providers. That's your choice. Think about it. You are paying them to guide you and to assist you during this very, very important time in your life. And so you are able to choose your providers, and this course will help you to make informed decisions about who you end up with as your healthcare provider. You can choose the location of your birth. A lot of times, what will happen is, depending on where our provider has hospital privileges, most births are occurring in hospitals, that tends to direct you to where you end up having your baby. You might want to think about it a little differently, like where do you want to have your baby, and who are those providers, midwives and doctors who have hospital privileges at that location. You may also want to think about and consider other safe locations for you to have your baby. Those safe locations can be a birth center and can be a home birth. And I will cover all of that in this course. My key to this is a safe location. So, with the optimum goal of a healthy mom and a healthy baby. That is my goal with this course, that your options are safe options for you based upon your health history, based upon how your pregnancy has been moving along. And those are important factors to consider. And then with all of this knowledge and information, then you're able to make very deliberative, informed decisions about your pregnancy and your birth. So what are you going to learn in this coaching program? Let me walk you through that. I'm sure that's a question on many of your minds. Why should I do this program? What am I going to learn? Let's look at what's inside, okay? The coaching program is online. Everything is in audio and video so that you can listen to everything in your car or on your computer or your mobile device. There will also be some checklists and other attachments for you to fill out to help you get through the courses and learn the information. This is a 4-week guided coaching program. And what do I mean by that? There's going to be 11 lessons that are divided up over these 4 modules. You can actually have all of this information given to you at one time, but instead of overwhelming you with all of the information, it is released on weekly time frames. So week 1, you will get all of the lessons that are included in module 1. Those are 2 lessons that look at your health history, and by that meaning for you to gather the health history for yourself and your family, as well as the baby's father. Based on that, you will be able to identify what are the things that came up that could be health risks for me during pregnancy or as I enter into pregnancy, and also during the post delivery period, which we call the postpartum period. You will learn in the first lesson. Everybody wants to know, how much weight should I gain in pregnancy? How much should I gain? You will know by the end of the first week how much weight you should gain, dependent upon what we call your body mass index. You will know exactly how much you should be gaining during your pregnancy. And that will be for you. It'll be different for everyone, but you will know by the end of week one. You will also know what is your normal blood pressure. That is very, very important to know as you move through pregnancy. So you will know that information by the end of the first week. By the end of the second week in Module 2, we're going to concentrate on looking at your insurance, what it covers, looking at what you have set aside for your family and for yourself for emergency funds. Do you have any? There are times during pregnancy when I've cared for women that I have made the recommendation for them that they need to go home, get off their feet, and be seen back a little more frequently than the usual routine of prenatal appointments. And also the question of whether or not you can stop working before your due date. That is a strong recommendation that I give to women, that if at all possible, can you stop working before your due date? And unfortunately, for a lot of our families, that is not possible because the woman's income is so critical to the family finances. So we're going to talk about having emergency funds set aside so that when these things come up, you're able to take care of them without that being an anxiety or worry for you as a financial pressure. And then again, looking at the maternity and paternity leave to know exactly what you have, what is paid for by your employer, what you would need to be responsible for, and to give you information around short-term disability, which can enable you to do some further things that you may not be able to do under just your own health insurance. I hope this will be helpful to you. Module 3 and Module 4 is Module 3, we're going to take a look at different types of healthcare providers. Like when you walk into a hospital, do you know who's taking care of you? And so we are going to go through every possible type of provider that would be taking care of you and your baby, what their background is, how much education is required for them to reach the point that they're taking care of you. Show you how you can look up their licenses, you can look up their certifications, you can look and find whether or not they have had any actions against them by the medical board or the nursing board, okay? And then also to teach you about the different types of facilities for birth: hospital, birth center, home birth, how to find the ratings for hospitals in regard to their overall safety grade, as well as their cesarean section rates, and which hospitals are baby friendly. I will refer back to my family once again. Where we live, there are three different county hospitals, all within the same amount of distance, all about 30 minutes away from where my family lives. And the cesarean section rate for those three hospitals ranged from 27% up to 42%. Okay. Now, if you were to go another 20 minutes further out, you could find one of the best hospitals in the country. And so Module 3 is going to teach you how to look up all of these different ratings for hospitals, cesarean section, baby friendly, so that you can make decision about what hospital you would like to go to. And then the last module, which will be 2 lessons, is now that you have all of this information related to providers, related to different types of facilities, hospital, birth center, home, related to your leave, you can then now plan out how you'd like your pregnancy to be. Like, who do you want taking care of you? What type of provider? Midwife versus doctor. With midwives, you kind of get both. Also, your access to informed consent, teaching you to look at a consent form that is provided to you online, usually from the hospital, that you are able to take a look at that consent form to see if it answers all of the questions that you have before you sign that. So these are the things that are covered under these 4 modules, 11 lessons. I call this module 5, even though it's not a written module. And what I'm offering as a part of this coaching program is a 30-minute call for wrap up. I will be doing once a week a 30 to 60-minute phone call with everyone who is enrolled in the program to see if you have any questions with the materials that you have received. The last group of students felt that they did not have additional questions so much, that the materials were very self-explanatory. But that once a week get together allows you to ask any questions that you might have regarding the course overall. What I do offer is an individual personal 30-minute phone call to be able to answer any questions that you might have that pertain to you personally. You may have found some information on the health history that you may want more information about. And so this will be done. I would like to have it scheduled anytime during that 4-week period to be able to answer those questions. And I call that module 5, even though it's not a separate module. Any concerns or questions at all? So you might be saying, well, why should I buy this course? I hope everything I've said to you tells you why. These are not topics that you're going to get in a childbirth education class, but additional information. What I would say is some takeaways from this is that maybe for the first time, you're going to know your family and your personal health history. Once you have gathered that health history, you don't need to gather it again. You will know it now and you will know it for the future. You can pass this on to your children. And all you would need to do is to update if there's some changes, say in your own personal health. That's all. So that's a big, big takeaway for this course. The other is you're going to know, after having gotten that, what are your personal health risks for pregnancy and also for your own life. Let's give an example. Say, for instance, you have a family history of diabetes, okay? That occurred when people got older. Well, when you have that history, then that runs the risk for you to develop diabetes. For women who have never had diabetes, due to the changes that happen in pregnancy, they may develop diabetes during pregnancy, and you are tested for this. Once you have diabetes in pregnancy, it could go away. You run a greater risk of developing diabetes later in your life. And so what this course will help you to do is to understand your own health risks and understand what those risks present for this pregnancy and future pregnancies, and also for your own life. You will also know what are the different types of services that you will get, what will be your leave, the different kinds of locations, birth locations, and what's safe for you. This you will be able to learn, and you will be able to take away this information from this course. Once you learn it in this course, you can apply it across the board for the next pregnancy you experience, and for life as well. One key thing is understanding informed consent. You're going to use this not only during pregnancy, you're going to use this for everything you do in life, for major purchases. If you buy a car, okay? If you buy a house, major purchases that you will make when you sign up for credit cards. You sign a consent form, whether you call it that or not, but you are consenting. Even when you download apps on your phone, it says that by signing this, I agree to policies and procedures or terms and conditions. That's an informed consent that you give when you click on that, saying yes, I agree to download this app. So it's important to understand how far-reaching informed consent is in your life. So you will take that away also as a skill that you will have learned in this course. And also, when you think about for your own baby and the things that you might want for your birth experience, you will know what are things that you can continue to have, whether you're have any issues with having the labor being induced or having to have Pitocin to augment the labor during the labor period, cesarean section. What about for your baby? What kind of care do you want your baby to have? What about being able to move about more freely in labor, being able to eat and drink? All of these things are things that can be a part of your birth plan and your pregnancy plan. And once you have put together a plan one time, you will only need to make some additions or edits for the next time around. And so it's kind of, once you've done it, you have the foundation for future events in your life. So the cost of this course is $497 for the 4-week course. And you might say, well, gee, what am I going to get for that? Well, with that $497, you will become a part of a private community in which you'll be able to interface with others who have gone through this course. You will have an access to all of the materials that are in the course for 1 year. So let's say you sign up for the course that will start on September 15th, Monday, September 15th. Even though we go through this course through the month of September, we'll end it in October of this year, you will have access to all of these materials until September 2026. You will also, as I mentioned, have a 30-minute session with me personally. And I am a licensed certified nurse midwife. Consider what it would cost for you to have a 30-minute visit in a prenatal visit or a women's health visit. You will come up with increased confidence to be able to voice the desires that you want for your pregnancy and for birth, not only with your family, but also with the providers that you will encounter during this time. You will know your health history for the first time, probably. You will also be very, very informed about health history, different locations for birth, OB providers, all of this, so that when you write up your birth plan, it's coming from a position of being well informed, knowing what you're getting, walking in with your eyes wide open. This course is worth way over $2,800. However, I will be offering this course for $497, and we'll move to the next slide. For the first 5 who sign up, the questions are welcomed, and I'll have time for that. For those who are the first 5 students who sign up before Monday, September 15th, I will be offering $25 off. So this is the link to the program, and also this link will automatically provide you with the code for that $25 off. So That is the Mastering Pregnancy and Birth Coaching Program in a nutshell. I hope that this has been informative to you. I want to encourage you to take this course, particularly if you're planning pregnancy in the next 1 to 2 years. And definitely, if you are a birth worker, this will give you additional information over what you learn in the doula curriculum. It will give you more tools to help guide families as you help them with the education that you provide to them. So I want to say thank you so much for your time. And if there's anyone who has any questions, I am open to receive them. Thank you so much. Okay, if there are no questions, thank you. I hope you all have a great, great evening. Thank you so much. Take care. Have a great night. Bye bye.